Hi, my name is Dr. John Shim, and today I want to talk about when you should get a spine MRI. As a spine surgeon, that's a very common question presented to me during an office visit. People will come in with complaints of neck or back pain, and the concern is, doc, I haven't gotten an MRI yet. Well, the truth is, you don't normally need an MRI unless you have some problems that tell us an MRI is going to be helpful to your care. We know that most people with neck and back pain will have pain for about 4 to 6 weeks. After 4 to 6 weeks, the vast majority of people get better. Well, if you got an MRI too early, now you spent a lot of money getting the MRI. You have some information that may hurt you later on when you apply for some sort of disability policy. And now you're feeling better, so that MRI provided you information that does not help you with your medical care. If you have neck and back pain and you do not have the issues that bring concern to doctors like fevers, weight loss, severe increasing pain, or developing increasing weakness, numbness, and inability to walk, we typically won't get the MRI until you pass that 4 to 6 week time period. If you have severe leg pain that doesn't get better, if you have progressive weakness where you're having more and more loss of strength, and if you develop some sort of issues where you can't control bodily functions like going to the bathroom, those are kind of emergent situations. Not only do you need an MRI, you probably need to be evaluated, probably in an emergency room. But if you just have neck and back pain and it's early on, and I know it's painful, you still may not need to get the MRI. That's up to your doctor to discuss with you. Your doctor should identify any red flags that tells him or her that you need to be seen right away and treated right away. If that occurs, you may actually go to the hospital. You may be admitted, and then the MRI is performed. But for the most part, doctors will order MRIs if you're not getting better after that 4 to 6 week time period, and you're still having some complaints of numbness or weakness or pain down the arms and legs, or sometimes just neck and back pain, and we'll order the MRI at that time. But don't be surprised if the MRI finds a lot of things. We know after the age of 40, about 50% of us will have findings on the MRI. As a doctor, sometimes we don't know if those findings are really the source of your pain. So the MRI gives us a lot of information. It may actually confuse the picture. So to avoid the confusion, especially when you're better, we normally wait until that 4 to 6 week time period. The MRI is a very useful tool. I do order a lot of them. But understand, sometimes the MRI really isn't not an advantage to you unless you actually need that study. Again, I'm Dr. Shim. Thanks for listening to us. Have a good day.